The vision and the design was to allow for somewhat of an open mic and open floor for members of the community to make comments or to present their thoughts. I'd like to move to that now. I'd like to reiterate that if you're seeking debate and dialogue, you'll probably leave here without satisfaction. That was not part of what we envisioned for tonight. Instead, we invite anyone who's so interested to come to the microphone, present your thoughts, present your opinions. I'd ask you to be concise. I'd ask for as much as is possible. People not repeat points that have already been made. They've already been put out in the public. I think that would suffice. There's a sign-in list up here. I'd ask before you make your comments, you inscribe your name and address. People are welcome to come sign up in advance of your comments so as to establish a sequence. That tends to be popular when we sometimes hold such forums. It's not necessary. There's a couple names already on this list. I'll call people up in turn that are already on the list. When the list is exhausted, I'll simply ask if anyone in the audience wants to come up and make comment. And again, I'll make one last reminder about the importance of civility and hearing all opinions, even if they may differ from our own. That said, the first name on the list is Nancy Allen. If you're ready, I invite you to come to the podium.
The CEWW Consortium was my account when I worked there, and I helped in the development and implementation of Plan B. After looking at audit results and projections for future health insurance costs, it appears that the current course of action or inaction is unsustainable, and even the make-whole arrangement that Ticonderoga has in place with Plan B and HRA is too little too late. Case in point, they just made the paper. They've got more budget cuts and they aren't sure where to make those budget cuts from. It seems that fiscally responsible action for Plattsburgh City School District would be to move the Plan B for all active and retired employees with a buy-up option to Plan A. This would allow employees and retirees to choose to stand on Plan A as long as they pay the difference. This is done with many employer groups. Employer percentage would be based on Plan B as well. The benefit of this would be an approximate savings to the district of $900,000 per year. That's a lot to save each and every year. Think of the programs. Think of the positions that could be saved. This could also be a cushion for the board instead of tax sales. This would provide choice to employees and also people that are on Plan B. Aren't utilizers, there could be savings to them as well. Plan A is a Cadillac. We've heard it talked about like that for a long time. It's a V8. It's been around since gas was 30 cents a gallon. That kind of says something right there. Almost every other plan has changed out there since this time, but not Plan A, except for enhancements. And that's usually New York State or the federal government that has mandated that. As you've just seen, Plan B, it's a Cadillac too. There are 3 exceptions: deductible, change in home insurance, and the RX. But it's still a very rich plan by today's standards. The majority of non-school plans have co-payment or member responsibilities for inpatient, for emergency rooms, for outpatient surgeries, for labs, for x-rays, and more. Those are all covered in full under both plans. Most taxpayers have plans that are nowhere near as rich as Plan B. Taxpayers are frustrated, and they're looking for some common sense solutions. And they're realizing they're footing the bill of extremely rich benefits that have been around 30 years for a very select group, while they themselves have health plans with high costs and out-of-pocket. Here's an example, just myself. When I go to the emergency room, it's not free. It costs me $250. When I go inpatient, it's not free. It costs me $500. And I'm willing to pay it. These are expensive services. Take Clinton County. When Clinton County people go to the emergency room, if they're under the PPO plan, it's $150. If they have inpatient, it's $250. These are common, and in many cases even higher. Deductibles are in the range of anywhere from $500 to $1,000. New York State, as well as most major employers, frequently modify their health plans to keep up with inflation and the increased cost of health care. Status quo for 30 years is almost unheard of. This has been going on way too long. And had there been modifications to Plan B or a plan to change B, we really wouldn't be in the same situation. This problem is a problem. It needs action. It's been studied. It's been looked into. But now's the time to change. Many local school districts have recently stated that their districts are endangered because unsustainable benefits, and healthcare is one of the biggest parts of that. This board and administration are well aware that remaining on Plan A is going to put a tremendous burden on the budget and district taxpayers. The increased shot in the arm that we just got with New York State money, that's not going to solve long-term problems. As a taxpayer, I'm asking the board and the administration to make a move to Plan B with a buyout option for Plan A for January 1, 2014. Thank you.
I have a point of order. Just a moment.
Sir?
I have a point of order. There's a list up there that certain people do sign to speak first, and it wasn't offered to the whole group. That's my point.
It was listed in the rules and parameters for this evening, sir. We're not looking to preclude anyone from speaking.
I didn't see
There's
any
but one more name on the list after this.
I didn't see any list.
What I'd like to do right now is proceed in the interest of hearing as many comments as possible, yours included. There's but one more name on the list, of Mr. Chmura, if you want to come to the podium. I appreciate the adherence to our very informal time limit of 5 minutes of the prime members last mark for the break. That will best allow us to hear from as many people as possible, so thank you.
Good evening. My name is Walter Chmura. I'm a concerned citizen. I'm looking at the big picture. We've all dread budgets because they always want more. And they've always wanted more for years. All of us are pulling up the bucks. But now taxpayers are hurting. Tax sales have increased quadrupled in the county this year. The school districts asked for Plan B to replace Plan A. They haven't moved quickly to that. Plan B was much less expensive, more flexible to industry changes, and carried a 3-tier formulary that really saved, as was mentioned by Mr. Locey. The savings could have eased budgets, provided stable programs, and technology for students, and still provided Plan B and excellent health coverage for employees. When healthcare first became a benefit, it was intended for individual employees. Then it became available for families. That was an affordable concession years ago. It's not today. One of the biggest cost drivers today in the budget is healthcare. And that has expanded into free Medicare Part B for retirees, $300,000 a year in our district right here. Buyouts for those who don't need insurance at $6,000 a year, totaling $800,000 a year. And Plan A, that would be a savings of almost $1 million a year. That's a lot that goes toward a budget, which keeps taxes contained, and that serves everybody in the district, and it preserves our district. Mr. Locey, in his 2013 report, said, because Plan B continues to demonstrate a more efficient plan model which provides an excellent benefit while allowing the school districts and BOCES to implement a more financially sustainable plan for the future. That's what we want to look at. It's not going through the hazards of a critical budget every year. I strongly urge the Board of Education to make this unilateral switch, saving taxpayers $1 million and still providing excellent coverage for the employees. That is right. It can be done without collective bargaining, which means it can be done expeditiously. A Plan B switch is the reasonable thing to do right now for the district. Thank you for your time.
The list is open. Anyone who wants to come come forward to speak, sir, or anyone else, sign in, please, if you would. I'll again, I want to reiterate great thanks and adherence to our content.
My name is Harry. I'm a retired teacher. I had to retire as soon as I was able to retire. So I missed that rush of big salaries that teachers were just beginning to get when I retired. When I first started out, my salary was $3,800 per year. And that is because I graduated with 4.0 average. The actual starting salary was $3,600. And therefore, I got $200 more than the average guy. Now, that didn't last very long, of course, because from that point on, whenever we got a salary increase, it was at the pleasure of the board. And they didn't take very much pleasure in that. Usually we would get $100 every 2 or 3 years. Now that's until we got into the union. When we got into the union and when the law was passed, which allowed us to start negotiating, I was right there on the first negotiating team, and I was on the 5th negotiating team as well, and every team in between. Now, as a result of that, we were able to improve our conditions somewhat. But it took an awful long time to go from $3,800 to a reasonable salary. I had a son who was born during my second year teaching. He went to high school and graduated. He went to college and graduated. And then he got a job down in Pennsylvania for $27,000, which was kind of unusual because my salary 22 years later was exactly the same. Now, I also joined the union, and I supported the people of Plattsburgh, and also the teachers of Plattsburgh, and the teachers in New York State, and the teachers in our country on the local, state, and national level. And I'm very proud that I was able to do that. Unfortunately, it took its toll on my health. I had to retire as soon as I was able, because by that time I had had 2 major operations. I had open heart surgery with three different repairs done to my arteries. And about 4 years after that, I had an abdominal surgery that removed prostate cancer that was very aggressive. I was forced to therefore retire as soon as I was able, as I said before, with a fairly low average salary. And that's a small average salary. I stayed pretty small right through this time. The only thing that has helped me a great deal has been the health insurance that I became a part of. Without that health insurance and that good quality of care, I'm very certain I would not be standing before you here today. My life has had several kinds of difficult problems, and so have I, since our retirement. I need very much a very good health insurance coverage that is not based on my last average salary, because that would not even come to begin to pay what I need to pay. What I'm asking for is, I'm asking for a situation which allows senior citizens like myself to be fathered, grandfathered in to a good insurance like the one we have right now. I know there are some people who would like to cut down their taxes, but I pay taxes too, and so do all of my relatives. And they don't mind kicking in to keep me alive. Now, in order to finish up my comments, I'd just like to give a parable to you. You know what a parable is? It's a teaching thing. There was a city slicker who decided that he was tired of staying, he wanted to move out to the country where he could have more air and more land and a better house that didn't cost as much as the city. He went out there all right and found a nice place in Altona. Now, land is pretty cheap in Altona, all right, and he got just a half acre of land with it. And he does a very nice little house. And as he looked out that window, he saw that he had about maybe a half acre of land. And he thought to himself, you know, I'm no longer in the city. I should be able to put a little garden there. The more he thought about it, the more he realized that there's no way that I can tear up that land by myself. But I noticed a little farmer down here on my way here, and he was out there pounding this old horse. Now, if I go out there and I can make him a good deal for that old horse, probably I can take that old horse here and I can plow up my land and I can plant some crops. So he went to the old farmer and he said, "Sir, I saw you have a very old horse there. I'm wondering if you'd like to sell that horse." And the old man and the farmer said, "Well, I'll tell you, this is an old horse, all right, but I wouldn't part with him for anything because I've got a really close relationship to him and he works really hard. But if you look over there, I've got a young horse, and that young horse is very young and he's going to live quite a few years, I'm sure." He said, "I'll even give you that horse cheaper than I would give you my horse." So he said, "Well, let's go over and take a look at him." So he went to the next door and he looked at this horse, and he looked great. He was all combed down, and his coat glistened, and he had all of his mane was well combed and had little ribbons in it, and his tail was up with a little bow around that. And he said, "Look at this horse, and he can move pretty good." So the farmer said, "What? I'll lead him." And he ran 25 yards, leading the horse, and the horse trotted along. Turned around, came back to 25 yards, and the horse came with him. And the young man said, "You only want that for that horse. That's great. I'll take him." So he took the horse to his house. Now, as he looked out the window, wondering when he was going to start plowing, he noticed that the horse began to look more and more bedraggled. And that horse, after a couple of days, would walk a few steps and then trip and stumble. He said, "Gee, I better call the vet for this guy." So the vet came, he went out, he looked at the horse, and he came back and he said, "I'm sorry, I'm going to put your horse down." He said, "What?" "Yes, got to give medicine or something?" "No, I got to put him down." He said, "Why would you have to do that? He's such a nice young horse." And the vet said, "Well, you know, I opened the horse's mouth, and I found out he's got no teeth. Now, if he doesn't have any teeth, he can't eat. If he can't eat, he's going to die."
Yep.
So it's really a good thing to put the horse down so he won't suffer.
Sounds like a plan.
And that's what he did. And that's sort of bringing me to the end of the story of this meeting. If you got an old horse, and that old horse is really working real good, don't go and buy another young horse without looking at him out first.
I also might suggest we use the area down here as a bit of batter's box. If anyone wants to speak, just needs to quickly change over. Please feel free to come by the seat down here for transition somewhat quickly.
Yeah, this is never mind. My name is Nona Guerin. I was born and raised in Plattsburgh, graduated from Plattsburgh High School, went to Plattsburgh State, and taught for 25 years here in the district before I retired 5 years ago. Several things have been mentioned this evening about the danger of looking at the savings of this plan and thinking that it's a panacea. But you must look closer. There are a large number of retirees who are represented in this plan, and I, for one, am a little worried. I happen to be one of the small percentage who really needs that health insurance. I've given everything to this district, including being attacked by a high school student with a knife, and I still suffer to this day, and I'm going through physical therapy right now for permanent damage in my neck from the attack. I didn't sue the district. All I asked was that my medical bills be paid for. Well, I'm a little worried now because several of the medications I take, and by the way, I have 15 different prescriptions that I take for various illnesses. 1/3 of those are in the 2 to 3 category, and I'm worried because one of them is a 3. And I went through 8 different medications trying to treat the acid reflux and ulcer I had from stress teaching in this district. And after going through 7 different medications, I finally found one that didn't make me more sick. And that's number 3. I have to take it. The other concern is people think that the teachers have the best insurance and the best paycheck and the best retirement. Well, I will tell you, the last 6 years that I worked in this district, the last 3 of which made my final average salary to determine my retirement, I was on longevity, which means there was no raise. My salary stayed the same for 4 out of the final 6 years. During that time, budget cuts were being made. Negotiations determined that we would make a lot of cuts and several concessions to the board to save money. And several of those contracts in those last, actually 8 years, were for 0% increase. Very few people know the details of those contracts. So I computed whether or not I would be able to retire. And I had to, health-wise. My doctor told me I must retire. And it determined that in the last 8 years, I had lost $5,000 in purchasing power due to the concessions in the contract. Now that loss also was used to compute my final average salary. Therefore, my retirement has also been hampered by that. It's a concern that people want to save money and blame the local districts and the local teachers and the local unions. But you really need to take a closer look at why the district is suffering. The cuts are coming from the state. The state has cut the budget over and over again. You need to look beyond your local district if you want to determine what is causing these shortages. Thank you very much.
My name is Steve Bedard. I'm also a taxpayer. I've been retired from teaching for 11 years. And what I find is I'm slowly becoming a walking pharmacy. And the thing that bothers me the most about Plan B, and really scares me, is the fact that right now I get prescription drugs that counts towards my $400 out of pocket. As you get older, you find that a safety net really becomes important. And what's going to happen, the gentleman who spoke is right, no one's trying to pull the rug out from you, but if we go to this Plan B, they're pulling the safety net out from you. Because if you go to Plan B, you go get prescriptions, and you pay out of pocket whatever you're going to pay. It does not come off that $400 out of pocket. And right now, I'll tell you, I feel pretty comfortable because I know as I get older, I take prescriptions. I've had cancer surgery, and knowing that I have that safety net, that they're not going to bankrupt me because I have a $50 deductible and a $400 out of pocket, I feel pretty good. That's pulled away from me, I'll tell you, I'm pretty nervous because any of us could end up bankrupt. You know, like you said, you don't have that crystal ball. If you don't have that crystal ball, I like having that safety. Thank you.
Well, you know who I am, Jack Stewart. I'm a taxpayer. I live in the city, and I've lived in the city all my life. And I've been a city official, and I've also been a teacher. And I've had the luck of working on all sides. I worked in private industry, and I had the fortunate time of working there. My last year on that so-called private job, at the lowest paid position, I earned $10,200. And that was a lot of money back then, and I was proud. Then I went in the Army, I came out, and I went to college. By my junior year, I was working 2 jobs on the outside and working as a college, in the college library for 15 hours a week for $1.15 an hour to match the money I was making running the garage and working on construction in the summer. With that, I had 2 children. And by my junior year, I had tears in my eyes one night when I came home at 11:30 at night to go to bed with 2 daughters in the house, and my $37.50 a week from the garage, and my $15.60 from the library at the college, and we had nothing to eat. And I said to my wife, I'm stupid. I borrowed money, I'm $10,000 in debt, and I have no job, and I'm going deeper because next year I got a student to teach. So my wife said, we've gone this far. We're going to finish the journey. And we did. And I went deeper in debt. But I had the fortune of getting a job in the Plattsburgh City School District, in the middle school, 1966. And the so-called Johnson years in education were there. And this was a poverty school. There were only 2 schools in the city of Plattsburgh at that time that were poverty schools, Monty Street and Plattsburgh Middle School, junior high. Because of that, I I could write off 50% of my national defense loan every year I taught in this school. And I was proud of that. But I got to tell you the rest of the story, because I'm an old horse. When I came to work here, I would have got paid a little more than Arnie did. They gave me $4,700. And they wanted to get rid of the assistant superintendent. And so they came and they offered us a $100 bonus if we dropped the fight with the assistant superintendent. Now what the hell is $100 over a 12-month period? You give up a friend? No. There's no way I would do that. So I went through. I served 36 years in this district. I served 27 years for the city. I worked for minor salaries for the city, and a pretty good salary I taught here. And in 2000 I retired. And since then, I had a prediction when I worked for the city, the poor workers that retired won't live too long. Because the only way you're going is down. If you live too long, you're going to be poor. But all those 36 years, I was healthy. I didn't have any problems. I didn't have any problems for the first 10 years I retired. But then one day, I went to the local doctor, and I made the mistake of asking a question. Check me over. He said, "Are you sick?" I said, "No, I'm not sick." "Well, why do you want me to check you over?" "Because I think I ought to be checked over. I'm getting older. And I've never had a check when I was a smoker." So he checked me. And I had every test that we did here in the city. And every one of them came back suspicious. Not suspicious. And they came to me and they said, "Well, we're going to have to go in there." And the local surgeon said, I need to get my hands in there. I said, "Lady, I'm already suffering from shortness of breath. I'm not giving up alone. At this stage, I want to know." So I got it. So then I had a daughter, and she got on the phone. I went down the phone. And I was lucky. She got me right in. And I got a good doctor. And they did all the tests. And when they got all done, guess what? It was still suspicious, but not conclusive. And they said, "We've got to do it. There's no way. We know what's there." So I did. I came home, and the first bill came. And I was horrified. I looked at that bill, and I got it on Friday. On Monday morning, at 8 o'clock, I was on my way down to the cellars with the bill. I walked in, and I said, "What are you there for?" I said, "I wanted to look at this bill. Tell me what the hell is going on." Well, he looked at it, and he said, "Well, you're okay." I said, "What do you mean I'm okay? If that's what I got paid, I'll take the fight. I didn't work my whole life. I'll lose it all right here." And he looked over across the desk and he laughed. He said, "You think you're the only one that's been this long?" He said, "You're going to worry about it. Medicare will get it." Well, thank God for Medicare. And thank God for Excellus. Because I made it through. I'm here today. I'm not perfect. I'm getting better. They're still looking for answers. I don't breathe as well as I used to, but that's understandable. I did 35, 40 years of smoking. I paid the price. And I'll tell you this one. I lose this health insurance. If anybody here loses this health insurance, they got to understand, you might never have been sick, and you don't know what's going to happen. But we're all a biological clock, and we tick. And something can come up, and then we're buried. Now, anybody can save money by taking away safety nets. We're doing that right now all over this country. We've got people who will never retire. And 3 or 4 years ago, before it all collapsed, I heard people sitting in the salon, "Well, we don't want Social Security. Why hell, put it in the stock market." Just think where we'd be today if they acted on that. In the same way with Medicare. And I heard people tell me for years, "We don't want socialized medicine." You don't have to have socialized medicine, you already got it. senior citizens got it, children got it, the poor have got it. The only people that don't have health insurance are the working people, the middle class. You're part of the 47%. Don't ever forget it. And everybody writes you off. And that's what we're talking about. There's a moral obligation. See, when you're young, when I started, you could negotiate. You could fight. You could join a union. And let me tell you, I didn't only join unions. I fought for everybody else along the way. I walked picket lines for other school districts, for prison guards, for public workers and public employees and county employees. Because we're all in the same boat together. And if we don't stick together, if we don't take care of our own, there's nobody that's going to do it. And I feel sorry for the younger teachers. Because what we fought for, thank God, we had older teachers that fought right along our side and received no benefit from the Great War. And now it's all disappeared. And it seems to be, you kick the horse that's down. You don't go out to help the horse, you go out to the sick horse. And the poor people are the sick horses. You're witnessing it now, you're witnessing it with gun control, you're witnessing it with when you lost and immigration. It's cheap, I think. It's not cheap. And what we're knocking down is our own economy. Because pulling people down to your level because you're not there isn't the way to solve the problem of this society. You have to go beyond that. You have to help everybody. If everybody wins, we all win. If we start butchering ourselves to save a coin here or a coin there, we'll give you the worst thing in the world. That's what society is doing. Take them apart. So I hope everybody that's in the position to make a decision thinks about the obligations. These people can't be negotiated. There's a lot of gray hair around here. We're over the hill with the old horses. And we don't know the faster yet.
We are.
Maybe we'd do better than we did. Thank you.
This podium is not entirely stable, so please be mindful of that. Perhaps don't lean on it too heavily, lest we should have to put into effect a very health insurance we're here discussing. Otherwise, we'll just carry on.
My name is Robert Dolan. I live on 84 Wall Street here in the city. And I attended some classes in college with Jack, so I can test all the cigarettes he smoked out and maybe that he's alive. But there's a few things I wanted to comment on, Plan A or B. When you're selecting generic drugs, they cost less. And why? You have to remember, in Rouse's point, we had Y-Therapy that made a lot of our medications, particularly antibiotics, and a lot of that stuff has gone overseas now. If you buy an antibiotic, it may be from India, it may be from China now. And is that generic the same? Might be, might not. Might not even be a drug at all, from what I've seen in the news.